So I'm here with Jacqueline.
Hi.
Yeah. So Jacqueline, just tell me a little bit about yourself, just for the camera. So I know you've lost a lot of weight. Tell me, how heavy you were when you started losing the weight.
Okay. I've been overweight most of my life. I'm 48, unfortunately, now. Lost sort of average or maybe 2 or maybe 3 stone at the very most.
Yeah.
On every diet imaginable. I've been to them all. I've done every diet. And my heaviest I got to 22.5 stone, and I was in a size 26 to 28.
Yeah. I've seen the pictures when you look really, those big trousers you had in.
Yeah.
And then, when did you start on the lighter life?
I started in April 2007,
Yeah.
and I weighed 22.5 stone, and I lost 7 stone in 5 months with them. I carried on after, because initially 100 days, the first 100 days.
Yeah.
This is total meal replacement, and you don't have any conventional foods whatsoever, but you get all your nutritions and all your minerals in with it. But what I found was, with Lighter Life, that worked for me is because food was a drug of my choice. Where people use alcohol and they use drugs, I use food to anaesthetise or my feelings or anything that upset me. So when I went on to Lighter Life, that took that away from me. That took my drug of choice away from me. And then I realised that how I was using food emotionally.
Okay. So you did really well losing the weight. Now, tell me, it was your arms, you told me earlier, were the thing that you really hated.
Yes.
Tell me about those.
The arms were the worst things in the body, because I think you can cover the rest of your body up.
Yeah.
I know you can with your arms,
Yeah.
but I could never wear anything like this, like short sleeve or even a swimsuit, even if I was slim enough, because people, if they would talk to me, they would automatically go to my arms that actually hung there. And as I was saying to you before, if there was one thing that I could have afforded out of all the surgery that I had, it would have been my arms, was my first priority.
Okay. Now show me your arms now.
Right, my arms
So
now.
prop them up now. So, I mean, they were really down here, weren't
Oh God,
they?
yeah, they were about, you must have took about 4, you've got about 4.
It was a lot,
Yeah.
Okay, and there's the scar now. So
Yeah.
if you put the scar down, so
Yeah.
you can't see the scar from the front and you can't see...
No, if I swirl around, you can't see from the back of it.
Yeah, so that's the thing about the scar, should be right in sort of the bit in the arm against the chest, so you don't see it from the front to the back.
Yeah.
And we did your bust at the same time.
Yes, you'd realigned my bust, which they were down here, so they went up to there at the same time. The operation, as I said before, there was no pain whatsoever, and that's the God's honest truth, no pain whatsoever with it. I was just on paracetamol normally, really well looked after here. I was having the dressings changed every couple of days, Aggie, and that changed it. Once the dressings come off, I bio-oiled, which you recommended to me, me and my husband every night, and it was well worth it, because there's just tiny spots.
Yeah, that's really gone really nicely now.
Yeah.
You can hardly see that, can you? So that's great. So how was the bust? We're not going to look at it.
No,
but just tell me.
the bust was really good. So the last time I said I had a pair of boobs like this was about 11, so that was lovely. That was absolutely brilliant.
And the scars on those?
Yeah, they were fine. They're the same as my arms. They are absolutely fab.
That was the first session. So tell me about the next thing that bothered you most was the tummy, wasn't
The
it?
tummy, the next, was the next operation to have done was the tummy, which you did, which I persuaded you to do another body lift, didn't I?
Tell me more what body lift is.
A body lift is like when you extend it from the stomach round to the back. You only left about 6 inches at the back, so it near enough was a body lift that you done for me.
And then, so we did that, and that was good at sort of taking off that lower bit of the tissue. So it took off, I think, about 4 kilos of tissue there.
Yeah.
Relocated your tummy button, but it doesn't work that well for the upper part of the tummy button too.
No, I was really disappointed. When the first thing I did when I come from the anaesthetic, I looked underneath and it was still there. Because above here, which they call the muffin top now, that was still there, and that was literally hanging. In fact, that was hanging lower than what my breasts were. That was bigger than my breasts, I think, then. So I was really, really disappointed with that.
Yeah. So we did that, and then how long ago did we do the last correct that?
It's 2.5 weeks ago.
Okay, tell me what happened. Tell me how.
2.5 weeks ago, went back in, 22nd of December, and you reopened the bottom of my hips there, because I had a couple of little bits of hanging still skin there, which is completely and utterly gone. And the best bit, you just took that away. You just sliced it from there, And now, as you can see, I haven't got the best thing to wear on today, actually. I should have put something.
It's pretty flat though when we looked at
yeah,
it.
sort of flat there. But you can see it emphasises my bust more now, because before this would be hanging, I'd have to wear controlled pants again. So, and it's just fabulous.
They've all gone with control pants now.
Oh yeah.
Yeah.
We had a burning session on Boxing Day.
Yeah.
In the chimney outside.
Really?
Yeah.
The smoke's going up.
Yeah.
Yeah. So that's really great. So any advice, you know, you've been through a lot, you've lost all that weight, you've done really well, you're probably about half of the body weight you were, aren't you? Any advice to anyone thinking of...
My advice to anybody is it's never too late. I'm 48 now. I mean, God, I wish to God that I'd have found this years ago, though it weren't available years ago. But it's never ever too late. And you're using food for a reason. We all overeat for a reason. When people say, because I used to say, I can't stop eating, and I never used to think I could stop eating, but I was using it as an emotional crutch. With Light to Life, not just Light to Life, there's other programmes as well out there, like the Cambridge and that, is that with that, it's took away, like I said, your drug of choice, and then you find out why emotional eating, because you can't turn to that food then. You have to cope with life without food. So my advice to anybody, just go for it, because it's just absolutely fantastic.
And once you've had that, once you've lost the weight, you're left with the excess skin.
Yeah.
Any advice to people about, you know, how you should tackle that?
Come and see Mr. Richards, because that is just, because it's just, as I said before, if I couldn't afford to have had the surgery after I'd lost weight, I probably wouldn't have lost as much weight, because I'd have stayed at about 15 stone, because it looked horrendous. So I would have left a bit more weight on to fill it out a little bit more. But if you obviously can afford to come and do it, it's like a new lease of life. Just
And I think the important thing is to prioritise which areas. So for you, it was your arms and bust.
First of all, stop. You can hide anything else, you
Yeah.
can clothe anything else, but for me to be able to have a short sleeve t-shirt, and I mean even in the winter now, I'm not going to wear any long sleeves, you know, and this is my problem to wear these now. But the top and my bust would have been my priority. Other people it may be different, they might decide the stomach was there, but for me it was the top half.
Well, brilliant. Well, thank you very much for coming to talk to us today, and hope to see you soon.
Okay, thank you.
Thanks. Great. Thank
Is
you.
that all right?